Hello again. You've just seen a tape on the last Great Disgrace, and what we would like to do now is bring abuse and neglect forward to what we might be facing today. I have a management team here from SDC that we are going to review some questions, and everyone is going to be discussing the possibilities of neglect, abuse, and what we think might be happening in the group homes today. What I'll start with is the question concerning whether this is abuse and neglect. 29-year-old Jim had been trying to button his own shirt for months. Finally, one morning, he successfully completed the task and proudly approached the direct care worker. The direct care worker did not express praise. Instead, she pointed and slowly unbuttoned his shirt and walked away. Is this abuse?
That's a tough one, Terry. It kind of seems very confusing what the worker did, so it does seem like it might be a form of psychological abuse. He or she didn't explain why she unbuttoned his shirt. She didn't say whether he did anything right or wrong, but then he or she walked away and just left the individual to not even know why they unbuttoned their shirt. Anybody?
I agree with the psychological abuse. Something that he'd been working on for a long time, and if he finally did it, it wasn't for her to take that approach, after he completed his task.
I would assume that there'd be a program in place to address this issue. So he's probably in some kind of program already, which has a proactive approach to it, which means he should be getting positive reinforcement for doing something. And since he hasn't been successful to this point, he finally did it. This should be cause for praise and adulation.
Anybody else have anything to add?
Well, we should speak to the staff member because he successfully completed the task, and he probably approached the direct care worker and no praise was given, and she slowly unbuttoned his shirt and walked away. So we should speak to her because this is not right.
Yeah, I kind of agree. I think there is a possibility of abuse, and I think what we need to do though is we would need to get into it a little more further and to find out exactly why the staff member would do such a thing and have that person at least give their reasoning why. But it doesn't make sense to me that someone would be able to button their shirt and to be proud enough to button their shirt, and then someone would come along and unbutton their shirt. I mean, we are bordering on at least a very sticky situation. Second question, Bill. He is a moderately developmentally disabled 11-year-old, and he is taken along with 7 other children to a playground by an aide. Bill climbs to the top of the slide, falls off, and breaks his arm. Is this abuse?
I don't think necessarily that it's abuse, because I think it depends on Bill's functioning level in the community and what he's able to do, what his plan of protection says. I think it could be neglectful if it's known that he is not to be engaged in activities like this.
It can also be neglectful if there weren't enough staff on duty to supervise all of the individuals. There were 7 guys there, 7 individuals there. So in that sense, maybe if they were understaffed,
Yeah.
it could be neglectful.
Question is how many staff were there, it doesn't say. So 1 per 7, which could possibly be what the staffing ratio is, but that would be the first thing you'd like to see is what exactly is the plan of protective oversight with the staffing ratio, and whether the agency has trained the individuals in the knowledge that they need to know concerning each individual's characteristics. If this is the first time it happened to Bill, it might be different, but if Bill is the type of guy that jumps right up to the top of the slide and falls off a lot, I think we need to know that. We need to give Bill a little extra protection.
Right, and we talk about the dignity of risk, so if there were the right amount of staff and if he is somebody that's able to do these things, then like anybody else, it was just a bad accident and you follow the proper protocol after that.
Yeah, I would agree with that.
Okay. Lisa. Lisa is an adolescent living in a community residence. Often she becomes hyperactive and disturbs other residents who are watching television after dinner. In order to protect the rights of the other residents, the manager locks Lisa in her room when she starts becoming disruptive. Is that abuse?
I believe that's definitely abuse. They're secluding her. She has the right to be out, doing activities. Maybe they could engage her in something that she's interested in doing to avoid her from having any issues with the other individuals.
But she's on a program that deals with her aggressive behaviors, and it includes giving her a timeout, and it's approved, by the Human Rights Committee, and everyone's in agreement, and the doctor signs off on a program, then it may not be. It depends upon the circumstances.
I would think that the staff probably needs a little further training and engaging this particular individual. It sounds like she could use some more stimulation as opposed to isolation.
Yeah, I think the way it's written, it's basically telling you that this is her almost normal behavior. So I think a behavior program should have been put into place. If she is disruptive every time they're watching TV, it's not like it's a one and only time. So there should be some type of formalized program that would at least give her some time to herself if necessary, but at least she'd have a staff member there and be working with her, so it's something proactive instead of something negative.
Yeah, her being locked in the room is very negative.
Yeah.
Jean is physically disabled, and she's a resident who has some walking skills, but who usually stays in a wheelchair because she often falls and hurts herself. During busy times at the house, the staff secure the seat belt behind her so that she won't get out of the wheelchair unassisted and possibly fall and hurt herself. Is this abuse?
I think if it's strictly for her safety, I do not think it's abuse, but if it's to stop a behavior, I think it is abuse, especially without something, in a plan.
Yeah, once again, if it's part of a behavior plan, then I would agree with you, it's not abuse. But if it's not part of a plan and they did it, then it's considered a form of abuse.
No, but I think for this one, it's mostly a safety issue. So, to keep her from getting hurt, that's why it's done. I don't think she has a behavioral issue from what's stated here. But if it's a safety issue and is, written down, then I don't think it's abuse.
So I think what we have here is whether it's safety and whether it's for safety reasons or whether it's for behavior reasons, and I think it makes a big difference.
If this is the first time it happened, and they tied her down for safety, that's probably one thing. If it happens with some regularity, then it's something that should have been addressed, by the Incident Review Committee and Human Rights, and should be part of a program.
Can I just add that I think the safety issue is obviously very important, and if it's just for staff convenience, then that would need to be looked into further. But it does sound like from the description that they're doing this for the individual safety.
And being that a seatbelt is involved, at times that's sort of like keeping her away from being free, so that could be an issue also.
Yeah.
Yeah.
Okay, James is a severely developmentally disabled resident who refuses to eat his dinner and is running a slight temperature. The direct care staff member decides to wait and see how he is feeling in the morning before reporting it to the nurse. By the next morning, James is running a high fever and has to be rushed to the hospital where he almost dies of severe respiratory infection. Is this abuse?
I believe he should have been reported immediately to the nurse. He was running a fever, and the nurse should have been called immediately.
Right, so it's really neglect.
Yeah. Definitely a form of neglect. It should never have risen to the level of needing to be rushed to the emergency room where the person almost died. It should have already been looked after and attended to.
Yeah, because once it's reported to the nurse will have something in place where staff will continue to take his temperature throughout the day.
Yeah.
And by the next morning, it would have never became the big issue that it had become.
This scenario also suggests that possibly James wasn't monitored during the night. To find out that he has a really high temperature and has other complications in the morning is far too late.
Yeah. During a wait in line for the facility van to pick the residents up, Pat, a resident, playfully shoves Martin, also another resident, who scuffles back. During these moments of horseplay, Pat steps off the curb, falls, and twists his ankle. Martin is worried about Pat and apologizes. Meanwhile, the direct care staff help lift Pat off the curb.
I think we have to find out what the staff member was doing when they got into the play. They started playing and shoving each other. But saying there was horseplay, and she stepped off the curb and she twisted her ankle. We just had to find out where was the staff member at.
I think it's more of an accident.
Yeah.
You know, I really don't think that a staff member can really be, have any blame for any real serious problem here. I mean, the word horseplay, I know it can be interpreted different ways, but it doesn't sound like anything serious. It just sounds like two people playing around. And, an injury occurs because they're playing around. To me, I think we have to remember there are accidents that do happen also.
This will be handled more as an occurrence.
Yeah.
The staff member was there to help I forget the individual's name, but did help the person get up and make sure that they were okay.
Mm-hmm.
And they should also call the nurse.
Yeah, oh yeah. Jerry is an adolescent living in an ICF. He often bites himself severely. In order to modify his behavior, the therapy aide on duty applies Tabasco sauce on Jerry's tongue and gums. Is this abuse?
I believe it is if it's not in this plan, which I doubt Tabasco sauce will be in the plan.
Yeah, I don't think we've ever read Tabasco sauce as being a part of a plan, so I think this is pretty obvious here. Is no matter what the intention is, the means does not justify the results. You cannot use Tabasco sauce or anything like that that's going to be any way distasteful or bring any type of negativity to the program. They would have to definitely come up with a much more positive program and not use anything like Tabasco sauce or pepper or hot stuff that's going to cause you to stop from biting.
But this might be one of those things that we see often where people might do it at home, as a measure for their own children or for their own families, where, it's okay in the home setting, depending on what it is, but being that we're regulated by OPWDD, it's pretty inappropriate and we have, strict guidelines that we have to follow.
Yeah, I agree with that. I've heard a lot of stories of people doing certain things in their house, so they would have to remember, about OPWDD.
I think this is one of the things that all training, everybody that's in the department with the training have to understand, that when you do bring in new staff members, that they have to be trained appropriately as to what positive reinforcement is versus negative. I know there's a lot of families today, and there's nothing wrong with what they do, don't get me wrong, they're saying it, but they do use negative reinforcement. And the fact of the matter is we can't do that, and I think it's something that we have to teach every staff member that comes in, that what you've learned from home cannot always be brought into the group home. They have to look at it a different way. A therapy aide is asking her supervisor in front of other residents about a new resident. The supervisor responds loudly, "Lopez? Just another Latino. PRs. Why do we get all these immigrants?" Is this abuse?
I'd say so.
Definitely.
Yes.
Yes.
It's an extremely culturally insensitive comment, and I would say in this particular case scenario, the staff definitely needs to be more understanding of the individuals that they're working with, and the fact that they are going, especially in our homes, we work with a very diverse population, and it's extremely important to be respectful and sensitive to everyone's culture.
So this is something where if another staff member heard this, they need to report it right away because this is an investigation into psychological abuse.
Yeah.
Agree.
Everybody agrees. Sean, a direct care worker, is seen rubbing his genitals against the bed while sponge bathing a young consumer. Is this abuse?
Yes.
It's totally inappropriate.
Appropriate.
Very inappropriate.
Very inappropriate.
Yeah,
Appropriate, inappropriate.
Yeah.
Abuse?
Shown as a role model, and he should be behaving accordingly.
It's a form of sexual abuse.
I think it
Yeah,
is.
absolutely.
Everything about it is inappropriate. I mean, it's a very uncomfortable situation for the individual, and this individual being bathed really doesn't deserve to be put through
Right.
that situation.
Yeah, I believe this is abuse also, and I think you're putting the individual in a very, very awkward position, the person being bathed. 17-year-old Betty lives in a community residence. Betty is being pressured by her boyfriend John to have sex. Betty asks her caseworker what to do about birth control. The caseworker's response is, "You don't need to know anything about that. You shouldn't get involved." Is this abuse?
Yes, it's limiting their rights. It's limiting Betty's rights.
Yeah, absolutely, definitely abuse. This individual clearly has the wherewithal to ask this question and was trying to learn more and become more knowledgeable about something, and it's not our place to withhold knowledge from our individuals that we work with.
Agreed.
The right thing to do in a situation like that would be to talk to the manager and possibly get some type of counseling so that the person can get some education or something like that.
While Rosemary, a 12-year-old resident, is watching TV, Tom, the resident aide, begins to tickle her. Rosemary doesn't like it and repeatedly asks Tom to stop. Tom says, "I'm just trying to make you laugh. You've been so quiet today." And he keeps on tickling Rosemary. Is this abuse?
Probably not until he started to continue tickling her.
After she has to
At
stop.
that point, it's definitely abuse.
Definitely abuse.
I think so.
Bringing it too far.
Right.
Not stopping when she has to stop. Grounds for firing, or?
Grounds for consideration for firing or probation or some other course of administrative action.
Yeah, pending the results of the investigation, there's a lot that's not in context.
That's right.
And he may need some training, you know, just so he can be aware of what's acceptable and what's not, what's abuse and what's not.
So, we just tried to answer 11 questions, and I use the word try because I want you to understand that some of these things border on abuse, some of them don't border on, some of them are on training, some of them are neglect, but each and every one has to be considered an individual event, and it has to be considered a serious event if someone is harmed in any way and their health or safety plays a part in this. So one of the things you will learn from this is that an incident does occur. Do not be afraid to go to your immediate supervisor and explain the incident as best as possible so they can help you making these decisions. And if there's a problem there, the management person who you went to or supervisor you went to should immediately go to administration if they too have concerns as to whether this is abuse or neglect. There are very, very difficult situations to try to handle, and I think it takes a team to do it. So on that note, thank you very much.